My name is Dr. Hari Iyer. I'm a hand and upper extremity surgeon, and I work at the Center for Hand and Upper Extremity Surgery. Quervain's tenosynovitis is a type of tendonitis that's located on the back of the wrist here. Oftentimes that can lead to a severe amount of pain anytime you're lifting anything. And we see it a lot in actually new mothers because they're lifting their babies in this position very frequently in this kind of motion. And that really irritates the tendons of the thumb. Very similar to trigger finger, there's a strap that sits right on top of those tendons. And as those tendons slide underneath that strap, there can be a lot of irritation. There's 3 different types of treatment options for Quervain's tenosynovitis. The first is immobilization. For this, we actually put you into a removable wrist brace that holds your thumb in this position and prevents you from really bending that thumb over and over and over again. And that allows the tendons to relax, lets them calm down, and that can cure the problem if you catch it early. The next stage of treatment is a steroid injection. We put an injection right here into the spot that's sore and painful, and that usually gives you immediate symptom relief. In about 50% of patients, one injection will actually cure the problem entirely. In the other 50% of patients, the symptoms will return in about 3 months or 6 months. If those symptoms return, the answer is actually to do surgery at that point. The surgery is very minor. What we do is we make a 1 centimeter incision right over the top of the area of pain. We come down through the skin and we find that strap that's sitting right on top of those tendons, and we cut the strap in such a way that elongates it and makes it wider. And what that does is it increases the space for the tendons and it allows the tendons to move freely. We don't cut that strap completely, we only make it bigger. If we were to cut it completely, it would require casting. We don't like to cast our patients unnecessarily. After the surgery, we place 2 small stitches to hold the skin together, and we place you into a soft dressing. And then eventually you can transition just to a Band-Aid in a few days. We want you to use your hands, we want you to move your hands, and they shouldn't be painful after the surgery. And so you should be able to rehab yourself pretty easily. In about 2 weeks, you come back and we take the stitches out, and then you're free, and you don't have any more pain, which that's our #1 goal.